World Cancer Day is an international day marked on 4th February to raise awareness of cancer and to encourage its prevention, detection, and treatment. Reports suggest that cancer cases in India increased at an average annual rate of 1.1 to 2% from 2010 to 2019. According to a report from the National Cancer Registry Program in India, 13,92,179 people in India had cancer in 2020 alone. The five leading sites of the disease were breast, lung, mouth, cervix, uteri, and tongue cancer. Today we have with us Dr. Tejinder Kataria, Chairperson, Radiation Oncology, Cancer Institute, Medanta Hospital, to tell us all about cancer. As we all know, the pandemic upended our lives and it became even worse for people suffering from a debilitating disease like cancer. Has the pandemic affected patients suffering from cancer, or have you seen more cases being reported during this period?
So you rightly said that the pandemic has affected all of our life spheres, including the patients who were either diagnosed with cancer or who were living with cancer. And although there is not an increase in the numbers per se of the cancer incidence, but what happened is that in the first year, because of the lockdown, the patients who had to come for treatment or who had to come for their diagnosis, they could not travel. So there was almost a gap of from March onwards till September, 6 months of delay in their getting to any hospital or any area where they could get themselves diagnosed, even if they had symptoms. Yes. So because of the travel restrictions, and then the fear of COVID during the second wave. So these two things, what that added up to was that there was a stage migration of cancer. So somebody who had symptoms and who could be picked up in stage 1 actually came up in stage 2 or 3.
Yes.
Right? And then their treatment changed. So a curative disease became, kind of palliative or a non-curable or a longer treatment or multimodality treatment, whereas we prefer to give in the early stages single modality of the treatment. So that happened. Secondly, the patients who were already on treatment, the ones who had started their treatment. So because of the travel restrictions, we had difficulty for them also because the civil authorities, because of curfews, would not allow them to come. So the hospital staff administration had to work to allow them to come. And so we started writing letters and we started making passes for them. So with that, we could get them through the treatment. Coming to your question about whether it caused more cases, I don't think. And reporting was definitely less because the number of cases diagnosed was less.
Okay. So we've talked about COVID, and let us talk about lifestyle changes. So it is believed that making minor tweaks in our lifestyle can mitigate the risk of cancer. To which extent is that true? How does lifestyle habits play a role in cancer?
I think that's a very good question, Arushi, if I may address you with your first name. That if we can have lifestyle tweaking or lifestyle modification, how does it prevent a cancer, or how does it mitigate anybody getting a cancer? So if we see only 30% of the cancers are something which are either inherited or familial, rather 15 or 20%. 80% of the cancers have some causative factor. And out of those, 30% are attributable to tobacco alone.
Yes.
Right? So tobacco is one major cause of oral cancer, especially in our country, larynx cancer, lung cancer worldwide. Mm-hmm. And there are unequivocal studies showing that the patients who do not consume or give up after proper, counseling, these products, their lifestyle change helps them not get the cancer or have it picked up early if they've already consumed it for a certain period of time. And we see in our own country when the people are consuming tobacco products like, churans, and all these, I don't want to name the proprietary names, but the mouth fresheners, which are so-called mouth fresheners containing tobacco products, we are seeing an epidemic of cancers in a younger age group. Normally, tobacco-related cancers we would see in the 5th, 6th, 7th decade, but now we are seeing them in the 3rd decade, 2nd decade, because they started off so early at age, because it's used as a mouth freshener. So that's something which the lifestyle will definitely make a change. Second is high-risk behaviors. multiple sexual partners for cancer cervix, and HPV infection, which is very well known for oropharyngeal disease, tonsillar cancer, and for cancer cervix, for now anal canal cancer, there are reports for that. So those behaviors are again lifestyle modifications. Plus being aware for your own health and going for your preventive checks. And then there is something known as the, viral cancers besides the HPV, the hepatitis C or hepatitis B virus. So that was found to be transmitted through the blood.
Yes.
So if the people are using syringes or using, products which are interchanged, then that can get transmitted to different people. And in that way, vaccination also plays a big role. So these are the things where we can look at. And alcohol. So the fourth thing is the alcohol, because alcohol is responsible for liver cancer, food pipe cancer, oral cancers and stomach cancer, and also bladder cancer. And then coming to another lifestyle factor, that is the industrial pollutants. Yes. And the environmental pollution. So if we have safe practices, our vehicular traffics are, conforming to the standardized norms, and they keep the pollutants low. Benzene exhausts are less, and the industrial pollutants are not going back into our water chain and into the food chain. So all these modifications can it's a huge task, and there are multiple agencies which are required, not only the health part, but the administration, the commercial aspects, the industrial, the production, everything has to work together to reduce the incidence of cancer across the population.
So we have now that you've mentioned the types of cancer, so can you tell us a little about the common types of cancer that affect men and women?
I think that's a very relevant question, because in India, amongst the men, we have tobacco-related cancers. Mainly the oral cancers are the top list, followed by lung cancer, and then we have prostate cancer, which is coming up.
Yes.
And for the women, we have earlier, when I was a resident 30 years ago, we had cervical cancer, which was very high. But now we are seeing breast cancer as an emerging problem.
Yes.
And cancer cervix has gone to the second place and third place in certain states. But amongst the women in the eastern side of the country, northeast, we have seen that the tobacco-related cancers are coming up. Okay. So, it's kind of the tumor registries that we have, funded by the national government under the National Cancer Control Program. They keep collating this data. We have hospital-based cancer registries and we have population-based cancer registries. So they collate the data, and every 5 years we get the information as to how the trends are. Yes. So talking of these trends, in Delhi, about 10 years ago, we had gallbladder cancer, which was very common amongst women. But now breast cancer is again coming up. So that's where we are.
Okay, so you mentioned tobacco-related cancers. So e-cigarettes are somehow the alternative to cigarettes. Do you think it's a good option or it's not?
E-cigarettes are more damaging to the lung as well as to the heart. So it's a misnomer or a misunderstanding that you can replace tobacco with the e-cigarettes. So that's not done.
Okay. So what are some of the early screening options that people should undergo to reduce the risk of cancer?
So there are screening strategies which are available and established for men and women both. For men, especially because of the tobacco relation and the smoking related lung cancer, there are studies which have shown that the people who have smoked for a certain finite time and X number of pack years, what we call 1 pack per day or 1 pack per week multiplied by the years they have smoked, they should go in for their low dose chest CT. X-ray will not pick it up, but a low dose chest CT, which is safe for them, that can pick up even a precancerous lesion. Early cancerous changes can be picked up in the lungs. So that is one screening strategy, especially starting in their 40s, if they started smoking in their 20s. And for colon cancer, if there's a familial history or somebody has bleeding per rectum or is losing weight, has alternating bowel habits like constipation and diarrhea, they should go and get a colonoscopy done. And that will pick up if there is any cancer or not, or some polyps. Sometimes there are polyps which can become cancerous, so they can be picked up. So that's a precancerous stage we can pick up. For the women, we have cervical cancer screening.
Okay.
which, if you know, for the last 30 years, we are talking about it, but in Europe and in States, because of their national programs and the health programs being built into their, programs of their uh, lifestyle, they have reduced the risk of cervical cancer by just one screening, which is known as the pap smear.
Yes.
So any woman who is sexually active for 10 years should go for a pap smear, and they should do it every year for 3 years, and if there are no changes, then every 2 years till the age of 45 or 50, and then it can be taken as per the requirement, as per the gynecologist. So a routine test, simple outdoor pap smear, which is painless, should be recommended for all girls of sexually active age. And then there is a vaccination which can be given to the girls prior to 6 months of their sexual intercourse, or getting 6 months before marriage. So that reduces the incidence of cervical cancer by 50 to 60%. So these are two strategies, screening and prevention both. Coming to breast cancer, there's enough literature there that doing a mammography, at least starting at the age of 40 to 45 years, and doing it every alternate year, every 2 years, and going up to the age of 60, and then maybe once in a year, or maybe certain protocols say 55, then other ones say beyond 60, you do it every year. In America, they do it start at 40, go to 50, and then do it every year. So I think there's a flux there, but you should see the doctor, and depending upon the risk factors, especially if there's a family history, like there is a first degree relative who's had breast cancer, then it should start, the mammography should start 5 years before the index cancer was picked up. So there are various guidelines for that, which an appropriate doctor can guide the person into looking at. So awareness should be there.
Yes. So there have been some major advancement in the healthcare industry in the past few decades for cancer patients. So can you enlighten us about them?
Well, there's a lot of changes which have happened, and they are mainly because of the software and the computing development, plus the influx of technology from other domains into the health, right? So one of them is, case in example, is robotic surgery and robotic radiosurgery. So the industrial robots have been brought into the mainstream for healthcare, for doing minimally invasive cancer surgery and also minimally invasive radiation. So we can treat a patient without actually opening them up with a cyber knife. So that is a robotic radiosurgery system. And talking of the surgeries, they have been reduced. Then we talk of earlier we used to do only chemotherapy. But after the body genome atlas was made, there's a lot of work which has been done on the genetic frontier, and we understand which are the drivers of the cancers. So there are targeted drugs, or even now we are talking of gene modification, especially after the COVID vaccination. We started talking of gene modification and gene vaccination to prevent the cancers. So there's a lot of things which are happening, but in the clinic we have immunotherapy and targeted therapy, which acts only on the tumor. And the immunotherapy engages with the normal immune system of a patient or a person, and also targets the tumor. So those are big things which have happened in the last decade.
Okay. So to alleviate the risk of cancer, can you suggest some preventive measures that people can undertake?
That's right. I think what I would say is that be aware of your body, and in case there is any symptom that is not going away with your normal treatment, like a cough, instead of putting it aside as a smoker's cough, you should see a doctor. If it's not going away for 3 weeks, or if there's a fever that's not going away after 3 weeks, there's a weight loss more than 10% in the last 6 months, there's bleeding, painless bleeding from mouth or any part of the body, especially for postmenopausal women, or men and women both, from their rectum, or women from vagina, painless bleeding which is intermenstrual or after contact with the partner, then these are the indicators that you should go in for a health check and have them investigated. And also any swelling on the body, like you have a small lump but it rapidly starts increasing in size. We still see women who hide their symptoms, and we see cancer stages which are very advanced by the time they come to us. So women should get away from the stigmata of not telling about their symptoms, and they should visit the doctor for any symptoms that are worsening or not going away. Second is that you should have a healthy lifestyle, as we discussed in detail in answer to your prior question. Having 3 or 4 or 5 types of vegetables and fruits, cutting down on the meat will prevent the rectal cancer and the intestinal cancers, and avoiding smoking and alcohol. I'm saying that you can't completely eliminate it, but reducing your own risk. And then having your vaccinations where it is required, especially for hepatitis B and for HPV vaccine for the cervical cancer. We hope that it's also going to be approved soon for the oral and the anal canal cancer, and if it does, then the men should also take it. So far it's only for women. So those are few of the things which if we do, we can not completely eliminate the cancer, but I think we can by and large reduce the risk.
Yes, reduce the risk. So that were all my questions, and it was great interacting with you. Thank you for coming to the health side, and thank you for your time.
You're welcome, Arushi, and I really enjoyed the interview with you. Have a good day. Bye-bye.
Bye-bye.